The heart after a heart attack is like a volcano. It looks calm from the outside, but is full of chaos inside, which could cause it to erupt anytime. As most of you know, a heart attack happens when a fatty plaque blocks the blood supply that supplies, the blood vessels that supplies oxygen to the muscles of the heart. And yes, that bacon this morning probably brought you slightly closer to it. The blockage in blood supply causes the muscles to die. And this is a big problem because the heart cannot regrow new muscles. So the dead muscles of the heart get replaced with scar. The scar causes the heart to be slightly stiff and swell a little. And this starts a series of problems that can result in a disaster like heart failure. Unfortunately, currently there's no drug available to effectively prevent this. So Grandpa, who feels fine after his heart attack and thinks he's recovering because he's watching his diet and taking his meds, is actually carrying a fist-sized volcano inside that could erupt any time and cause problems like heart failure. And this is where my research comes in. I'm trying to figure out if we can regrow heart muscles. And I believe I've already achieved that in mice. How? Well, you must have heard of stem cells. They're the new buzzword in the media these days. But the stem cells that I'm talking about are slightly different. They're cardiac stem cells, meaning stem cells of the heart. They can potentially turn into any cell in the heart, and that includes heart muscle cells. But they're so small in number that on their own, they can't make a huge difference. However, if we can figure out signals that can cause these cells to grow in number, then maybe they can have an impact. And that's exactly what we did. We found that if we block a signal called the Wnt pathway with a drug, then we can cause these cells to grow massively in number in mice. And more excitingly, we saw that the mice that got this drug actually had much better functioning and well-recovered heart compared to control mice that didn't get the drug. So now I'm testing how effectively these stem cells can actually become muscle cells. And once we figure that out, I believe we can use this drug to help regrow new muscles in humans too. This drug is already being used in clinical trials for cancer. And I believe with my research, we can use this drug for heart disease, which kills more people in the United States every year than all types of cancers combined. So soon enough, Grandpa, after his heart attack, can come home with a recovering heart instead of a small active volcano. Thank you.